Welcome everyone, Dow Labs practitioners and affiliates. This is another webinar with me, Dr. Eric Karchmer. Today we're going to talk about COVID-19 some more and do some case studies. Think about how to manage our patients in these unusual times. Last week we did kind of a basic overview of some of the formulas we sell here at Dow Labs. And today we're going to kind of do a little bit deeper dive based on primarily on sort of my own cases and some of my less conventional uses of these formulas, which I'm excited to share with you, and I think will help you augment your own practice. So today our goals are going to be to learn how to take advantage of herbal medicine to supplement our practice during COVID-19 when social distancing means that many of you can't see patients in your own clinics, just like last week. But this week, we're really going to try and focus on some new or less conventional uses of Dow Labs formulas as a way to kind of better serve your patients during this time. So a quick little agenda for today's webinar. We'll be talking about a little bit about COVID-19 and treatments in China, as I've have been learning about them, some of the common formulas used. Talk a little bit about some treatments I've done. We'll talk about the sort of standard diagnoses for COVID-19. And then we'll turn to Dow Lab formulas, sort of what I'm saying, in the age of COVID-19. These are some of the things that are sort of based on my cases or how I use these formulas, and I think would be great options for all of you at this time. Then we'll sum up with a couple little tips on using the patient summary form, staying in touch, and some upcoming webinars. So let's start with COVID-19 and some of the treatments I've been reading about in China. So those of you who have been following it, you may or may not be familiar with some of the standard symptoms we see, but we tend to see fevers, not always fevers. And if there are fevers, not necessarily high fevers, chills, headaches, body aches, nausea, bitter taste, dry throat, dry cough. Recently, we've been hearing about a loss of the sense of taste and smell as well. Tongues, I think, are interesting here. Pictures, at least I've seen from some doctors in China, have often featured sort of tongues with like a thick, white, greasy coating. Really some clear signs of dampness and definitely of cold. And so that's actually the pattern that I think I've been hearing about from most practitioners in China. Cold and dampness in the lungs is sort of the main concern here. So for treatments, now this is also how well, this is not that different than how I often treat many common colds, but we want to use warm, acrid, exterior releasing herbs, as well as some cough relieving, phlegm transforming herbs. So I've treated a couple cases, and they've seemed to kind of resolve relatively quickly. Again, we have, as many of you know, we have a really wide range of presentations here. Some people are being terribly, severely sick and ending up in critical condition. Others are having very mild symptoms, or sometimes sometimes they're even almost symptomless, and they're seem to be carrying the virus. But in my practice, I've used sort of what you might call it a version of a guizhi cinnamon twig decoction with a few additions. Jiso-san, which is cough relief powder, I've kind of used the two of them together and had some really nice results. Another important formula is ma huang tang. This is being used really widely in China. This is a ephedra decoction. It's kind of impossible to get ephedra or ma huang these days here in the US. But it would be, if you were seeing coughing and wheezing, that would be almost an essential herb you would need to have in your formula. Ma huang fu zi xi xin tang is another one I've seen some reports on. This is a very warming, Fudza, which is aconite, and xixing, which is a sarum, are two very warming herbs. Mahong itself is also warming. So this would be a very warming formula for patients showing very strong signs of cold. Sometimes we have a tendency in Chinese medicine to equate infections with dampness and heat. So I think it's interesting that I'm reading about practitioners that are using these kind of classic Shanghan or treaties on cold damage formulas like Ma Huang Fudzi Xixing Tang. That's where that decoction comes from. We want to be open-minded to that. I don't think any of us here, practitioners in the US, are really going to have probably much occasion to be using something like Ma Huang Tang, a Federal decoction, or Ma Huang Fudzi Xixing Tang. But anyways, to be aware of that, and that's sort of where that's how the disease tends to progress towards more cold, more phlegm, more interior dampness. So from practitioners that I've heard about or read about in China, Ephedra Mahong has definitely been kind of this essential herb when you get to these more severe stages with coughing and phlegm and difficulty breathing. Okay, well, a lot of us are probably not going to have much occasion to be treating COVID-19 patients. I've done just a little bit of sending by mail some herbs to patients kind of up in the New York area. What we're much more likely to encounter are people who really are concerned with prevention and trying to stay healthy during the pandemic. We know that COVID-19 is, for the most part, really affecting the elderly and the immunocompromised the most. It's been the most virulent for them. So our question today, and kind of what we want to think about in terms of sort of case studies, if you will, is how can we best help patients stay healthy during the pandemic? Please refer back to my previous webinar just for some basic introductions to the formulas. But today I want to do some slightly different introductions, and this will give you, I think, some options and learning how to use Dao Lab products. So now I'd be remiss if I didn't mention sort of like maybe the standard go-to product, which is Yuping Feng San, or what we call immunity support, also known in English as jade windscreen. This should be maybe your first thought for somebody who's just looking for something preventative and is otherwise relatively healthy. This formula supplements qi and it fortifies exterior. It stops excessive sweating. And because it supplements defensive qi, it's a very important formula for treating anyone who has sort of recurrent colds or recurrent upper respiratory tract infections. This is an essential here. It is also kind of a great formula for like pollen season and for folks who are dealing with various kinds of allergies. That's also, we're getting to be that time of year too, so that's also a consideration too. If you notice, if you've got patients who are struggling with allergies, that is also a sign of a certain kind of sign of deficiency. So, for both those reasons, this can be a great choice. Let me go from here though, and I'm going to just sort of pause there on immunity support. There's so much you can say about this formula, which is so amazing, but that's sort of your standard go-to. But let's move on to some of the less conventional formulas I think that might be really appropriate for this time and this pandemic. So let's talk about digestive harmony. Dampness is a big consideration in COVID-19. We hear about people having nausea and various digestive complaints as part of the illness. We also want to think sort of preventively here too, like if dampness and if digestive issues are produced by COVID-19, we want to anticipate too that this could be a problem for our patients. And so I would just say any patients you have who are struggling with digestive issues, this should be, something you're thinking of. So what are some of our key principles here? Well, one, we know that the spleen is the foundation for acquired essence. So the spleen and stomach are absolutely essential to just overall health. The spleen and stomach produce and engender qi and blood. And one important thing about digestive harmony, which is less of it's not so much a spleen tonic, but it's really a formula that really addresses the stomach. Often we want to treat the spleen through the stomach. And one key principle for treating the stomach that doctors in China will often talk about is they have this sort of phrase, wei yi tong wei bu, which means for the stomach to open is to supplement. So supplementing herbs, in fact, sometimes can be a bit of a challenge on the stomach. They can be too rich, too cloying. So we want to make sure that the stomach is always open, flowing, harmonious, and sort of achieving its sort of descending functions. And so to keep it open is absolutely essential. And that's how you ultimately sort of then supplement and strengthen the spleen. When we have patients with whose spleen and stomach are strong and healthy, they're going to be at their fullest, their greatest capacity for resisting infection and staying healthy. So I think digestive harmony is actually a great formula to think about at this time. And in fact, if it was me, I would, if I had patients with digestive issues who are concerned about staying healthy during the COVID-19 pandemic, I'd probably recommend this maybe over immunity support, or I might even recommend a combination if I felt like they also had some clear spleen deficiencies. Another thing to kind of think about here too is this formula is also just a kind of a great formula for like modern lifestyles. Our diets tend to have a lot of cold, raw foods, or sometimes they have rich and cloying foods. Our lifestyles tend to be too sedentary, and all of this can like lead to dampness and phlegm. So here's where digestive harmony is kind of like also just for our general lifestyles, a great fit for what's going on with many of your patients these days. And of course, with COVID-19, we're even more sedentary than we typically are. So I would say for your patients with digestive issues, I think digestive harmony should be one of your first considerations. You might combine it with immunity support. You might also want to think about either combining it with emotional balance or perhaps just using emotional balance if you've got some emotional issues involved here. And I won't go too deeply into that formula, but emotional balance is, which is Xiao-Yao-San, is sort of your go-to formula for dealing with qi constraint. And if you've got emotional issues which are leading to qi constraint, which often then in turn cause digestive issues, that might be your choice instead of digestive harmony. But keep these two formulas in mind for any of your patients with digestive issues. So let's take a look at another formula. I'm sorry, let's stick with that. Let's take a look at another problem, sleep, but stick with digestive harmony. And I've done some more comprehensive webinars about digestion and sleep. So it's something we want to keep in mind. At Dow Labs, many of you may be familiar, we sell two formulas, Gui Pi Tong, which we call mental tranquility, and Tian Wang Bu Xin Dan, which we call physical tranquility. We sell these, as sleep remedies, as things to help patients improve their sleep. But one aspect of, or one element of dealing with patients who have disrupted sleep or dealing with insomnia is to also consider digestion. So this is very important. And of course, we all know that sleep is really sort of essential to one's health and one's overall immunity. So if your patients are sort of really complaining about insomnia, digestive harmony also might be something you want to think about here too, particularly if they have digestive issues. So there's a famous passage from the Yellow Emperor's Inner Canon that sort of explains this particular use here. If the stomach is not harmonious, sleep cannot be peaceful. This is not really that unusual a use of it. We just have to remember here, part of the issue is that sometimes our patients are focusing on one problem, or for example, if one problem and not another. For example, if sleep is sort of more recently disrupted, and insomnia is sort of a less chronic issue, they may focus on that in their complaints to you, and forget to mention that they've had digestive issues for 20 years. So always remember to inquire about gastrointestinal issues when it comes to disrupted sleep. And digestive harmony can be an excellent choice for these patients, and really kind of an essential choice. And I've given you two images of tongues over here on the left. If you're not seeing patients in your clinic, get them to take a picture with their iPhone and send you a snapshot. The iPhones do a pretty good job. Our smartphones do a pretty good job with the tongue pictures. The one on the left is probably shows up maybe a little bit less red, but nonetheless, what we're seeing than it should. But what we're seeing on the left is a red tongue with a thick white to slightly yellow coating, and what we're seeing on the right is a pale tongue with a thick white kind of greasy coating. That's greasy in both cases. So we've got damp heat on the left and cold damp on the right. In either case, digestive harmony is a good place to start. Now, the tongue on the left with damp heat is probably something you may see a fair amount of with your insomnia patients, and that can be tricky. Herbs to treat dampness often can be warming, and they may exacerbate the heat issue. So it can be a little bit tricky to treat, but nonetheless, you can't the sleep issues can't get better without first dealing with that dampness. And so, if you saw either of these tongues, you'd probably want to go to something like digestive harmony first before you ever got to either mental tranquility or physical tranquility. You'd really want to save those for when the phlegm and dampness issue has been resolved. So, okay, well, those are some tips with digestive harmony and sleep. And I've had many interesting cases with patients where the treatments have been more complicated than this, and something that sort of beyond digestive harmony requires bulk herbs and a much more individualized formula. But the principles are the same. And I've had numerous cases where resolving digestive issues has just transformed a patient's ability to sleep at night. Okay, so let's turn now to mental tranquility. But instead of thinking of it as a sleep remedy, let's think about it in terms of its gynecological uses. So mental tranquility is Gui Pi Tong, restore the spleen decoction, or return to the spleen decoction, depending on how you like to translate it. And there's a couple key principles here involved for thinking about some alternative uses of it. One is that mental tranquility, or Gui Pi Tong, is a formula that primarily supplements qi, and in doing so also supplements blood, but it supplements blood by first addressing qi. And spleen qi deficiency is a common cause for excessive menstrual bleeding, particularly with women who are approaching menopause, in perimenopause, or in menopause. And that's because the spleen has the function of sort of governing or ruling the blood. And so you may see what you may see is spotting or just heavy bleeding in these situations. And another situation we want to think about here too is that blood deficiency, and that then goes together with a spleen qi deficiency, is one of sort of the primary conditions or the primary states of postpartum women. 9 months of pregnancy, labor and delivery, these have a severe toll on a woman's body, and there's just lots of blood loss in labor and delivery. And that leads to a whole host of potential complications for postpartum women. So you want to recognize that mental tranquility is going to be a great tool both for your sort of postpartum women or your women who are approaching menopause, in menopause, perimenopause, those states. So in terms of applications here, you want to consider using mental tranquility for women with heavy spotting, with heavy menstrual flow, or sort of spotting before or after their period. Both of those situations can be a sign of the spleen's inability to govern qi. This is a great use for this formula, and particularly around the, you might want to use it sort of use it around the time of the menstrual, of menstruation, but then keep using it throughout the cycle. And this is going to be really important. And for women who are struggling with, particularly with heavy menstrual flow, they may be tending towards anemia, certainly kind of blood deficiency by Chinese medicine standards. So you might want to also think about combining it with women's formula, which is Dao Labs women formula, which is Su Wu Tang. And so this could be a great combination for some women. In this situation, if you're dealing with, say, heavy menstrual flow, I've often had my patients take Su Wu Tang sort of right after their period finishes for a week or so, or sometimes I've had them also do it just like throughout the cycle. I might have them do a women's formula in the morning and like mental tranquility at night to help with sleep. So that can be a great combination there. To return to the postpartum women, postpartum women are going to struggle with a lot of things. So in addition to sort of just recovering from pregnancy, labor, and delivery, they're also dealing with breastfeeding and babies that don't sleep through the night, and perhaps jobs and all kinds of things. So, we're all familiar with women struggling with postpartum depression, and even if they're not depressed, they're probably fatigued and not sleeping well. If you see sort of that pale, puffy tongue, sort of I've got at the bottom of your screen there, that's probably a great time to use mental tranquility to help these women recover. And it can really be, I've had situations where it's just really been immensely helpful. It's just really been almost life-altering. They've responded so well to this treatment. And this is another situation too where you might think about really combining it with women's formula if you see like a really strong blood deficiency, or kind of a pale tongue, but also maybe more dry than moist. Then add in women's formula. Maybe do both. Maybe one in the morning, one in the evening is another great combination there. So Gui Pi Tong or mental tranquility has like a number of like really great gynecological uses for perimenopausal, menopausal women, as well as postpartum women. So it's such a great formula. So keep in mind these are somewhat alternative uses, and I've used it a lot in these ways. And I would say if you're unsure of what to do, I would always sort of ask to see a woman's tongue. If you see that pale, puffy tongue with teeth imprints and kind of just a thin white coating, this is going to be a good fit. Okay, let's look at one more formula here. So joint fatality is the Dao Labs version of Du Huo Ji Sheng Tang. This is an amazing formula. I just don't think it's maybe appreciated enough for how great a formula it is. I personally take it almost every day, and it's been so helpful for me. So I have a real soft spot for this particular formula. So here we want to, in terms of kind of our COVID-19 pandemic and helping patients get ready for that, we want to recognize too that one issue for patients here is chronic pain. Now, some people don't complain about chronic pain because they're just sort of used to it, but you want to inquire with your patients if they've got some chronic pain, and if this is sort of what's called a B syndrome, a blockage in Chinese medicine. Joint fatality may be like an absolutely essential formula. So to back up for a second, we want to remember that chronic pain has two causes in Chinese medicine. There's either no free flow and that would be of qi or blood or what have you. So there's some sort of like obstruction, or there's insufficient flow. That's from a deficiency, and therefore you can't, qi and blood isn't getting to an area. We get pain that way. The first one is more, would be in essence, a problem of excess. The second, a problem of deficiency. We would expect the first one to have like more intense pain and the second one to have less intense pain, but that's not always going to be quite so easy to distinguish clinically. But nonetheless, we've got pain caused by excess, pain caused by deficiency. And so we want to remember with a lot of our patients with chronic joint pain, arthritis of various sorts. And remember, arthritis is also can be a big catch-all for a lot of physicians. Just to describe sort of pain, just general pain. Chronic joint pain is really a sign of deficiency for our elderly patients. Now, it's not merely a deficiency, because what often causes the pain then is going to be some kind of external excess, and this is going to be typically wind, cold, and dampness. So that's our classic theory of the B syndrome: wind, cold, and dampness unite to cause a blockage. But the fact that they can cause a blockage is really this precondition of some sort of deficiency. So this is where joint fatality, Du Huo Ji Shan Tang, is such a useful formula. It's so helpful. We'll see it addresses both the deficiency because it supplements the liver and the kidneys. It also supplements qi and blood. And it also deals with the excess. It also dispels wind, cold, and dampness. This is perfect for COVID-19 because wind, cold, and dampness, that is exactly sort of what's causing the illness to begin with, right? It's the cold and dampness. Of course, they're brought by wind that are getting into the lungs and making people sick. And then it's also dealing with some deficiencies here by supplementing liver and kidneys, qi and blood. So if you've got patients who are struggling with some various kinds of pain, particularly sort of chronic pain, and I'd say chronic joint pain, but not exclusively joint pain, this can be a great formula. So going back to postpartum women for a second, many postpartum women will struggle with pain, and it could be abdominal pain, but it might be also in the extremities. This may be your go-to formula here, and it's got, again, all the essential elements. It can deal with the excess, which is the wind, cold, and dampness that sort of gets into the channels as a result of deficiencies, and it can also deal with the deficiencies that are the precondition for it. Fibromyalgia is, a problem that so many people deal with, and this diagnosis is a bit of a catch-all for a whole bunch of things, but in many cases, what we're really looking at is sort of a classic B syndrome in Chinese medicine. And so this formula can be so useful. So if you see, particularly middle-aged to elderly patients, signs of various forms of deficiency, joint fatality is really where you need to look. Sciatica, low back pain. I've had some really impressive results with using this formula for low back pain. Now, I might often combine it with acupuncture if that's not possible now. Sometimes the herbs are better than the acupuncture, and this can be just absolutely essential. And you want to make sure you get your patients on this. And then lastly, for any kind of sort of joint injury, athletes who've kind of just abused their bodies, that's sort of, again, a classic sort of way that we get arthritis. This is a great formula to turn to. I have on occasion had some patients complain a little bit about digestive issues with this formula. And I'm not sure if it's the herbs are some of the supplementing herbs are a little bit cloying, or if it's just these, probably more likely it's some of the acrid dispersing herbs are just a little harsh on the stomach. So a really great thing you can do is sometimes combine it with Digestive Harmony. Perhaps have people alternate. Another thing to think about with joint pain and arthritis is that we also need the spleen and the stomach to be really solid and strong. And so if you have patients with these issues and they're struggling with digestive issues, digestive harmony is really kind of almost an essential complement here. And again, you know, as we know, a deficient spleen is going to engender dampness, and so we've got to deal with sort of spleen and stomach in order to really deal with, get to the root of this problem. So these are another great combination of formulas here. I've also noticed with some of my patients that I've had somewhat surprising, but like great results for like sinus issues, nasal congestion, various things using joint vitality. So that's something for you all to consider. Again, probably the dispersing, wind dispersing, you know, dampness, eliminating herbs are a great, probably great benefit to some of those conditions. So again, joint vitality, a perfect formula, I think, for your elderly patients who are worried about COVID-19 and concerned they might get sick. If you've got those patients who also have some arthritis, some joint pain, and then here you also, again, you might want to look at the tongue again. This is a warming formula, so as long as you see a tongue that looks on the paler side, they're going to be probably a good fit for this formula. If you do see a red tongue, then you'd have to kind of proceed a little bit more cautiously because the formula is quite warming. So that's sort of my little summary of some alternative uses of Fidelity Labs formulas and ways that I use them in my own patients. You notice here that I talked a lot about combining formulas, and I think that's actually something I do a lot, and you may or may not be used to doing that a lot as a practitioner, but it's really quite effective and sometimes essential. So, you know, at Dial Labs, we really recommend that you all get the patient summary form. You can now kind of find that in the practitioner resource room, and give your patients some write down some guidelines here, some notes for them, so they know how to do it. So, if, for example, you're combining a women's formula in the morning and mental tranquility in the evening, write that down and really give them some clear guidance on that. That's really going to help with compliance and going to make you know, I think a big difference in the clinical results. If you're combining joint vitality with digestive harmony, again, you know, that's a great combination. And but you know, give clear notes to your patients, and they'll I think the results will really improve for you all. We've got, we want to remind you all that there's lots of ways to stay in touch with us, and we're trying to kind of do our best to stay in touch with you all. And I think this is a time where we feel like everyone needs to kind of work together to keep clinics and practices open and thriving. So we want to encourage you all to join our Facebook group for lots of practitioner insights there. The Pulse newsletter is also a great resource. We send that out bi-weekly. And we're going to have a bunch more webinars coming up just to kind of really keep the juices flowing here and keep you all kind of engaged and thinking about how we can really do as much as possible during these times. So in 2 days, on this Friday, my partner, John McGarvey, and our business development director, Jen Ward, they're going to be online. And this is a great chance to just kind of get some real business tips in terms of how to you know, make the most of your practice. John and Jen are both great resources. I'm not going to be helpful for you at all in terms of like thinking about business, but they will, and they're going to really kind of give you kind of the tips for like how to get through how to get through these unusual weeks. In a week, I want to talk a little bit more about just like kids, keeping kids healthy at home. How can Dial Labs help with that? A lot of your patients are going to be home with their families, and we've got to make sure everyone's happy. So we'll have a little pediatric focus next week. The following week, we're getting our sort of Show Us Your Tongue campaign going again, and we'll talk some more about sleep formula. So we'll do a deeper dive into into sleep and sleep complications. And then the following Wednesday after that, we may come back to Baohu 1 and talk about even some more uses. So there's a lot coming up. Stay tuned. These webinars are going to hang out in our resource room, so they're always there for you to go back to. And we're wishing you all the best, and let us know what your needs are. Get in touch with us. We're happy to kind of, to modify what we're doing according to your needs and your demands. So best of luck to all of you, and stay healthy, and let's keep our patients healthy. Okay. Thanks very much.